And if you haven't noticed already, the way Ken and Rasan and the group has set this up is kind of taking you through, if you were a beginning rider like myself, you purchased the ride, you purchased the bike, you probably spent a nice little piece of coin on that, you should get a bike fitting, right? As you're riding, you start to experience some different things where you may want to go ahead and see a chiropractor. Has anybody seen a chiropractor since you've been riding? Amazing, right? It makes a big difference, especially when the chiropractor knows what they're doing. I want to introduce, that's a big part right there. I've been to some chiropractors like, brother, you're never touching me again. Dr. Bret Hofer. Now, this guy is very interesting. I was talking to him a little bit outside. He's practiced for over 25 years. He's from the East Coast. He's out here on the West Coast right now. You can't tell me that the weather doesn't break down bodies a little bit differently, right? So I understand that he knows that right there. But he's very much into making sure that everybody's focus, his focus is mobility, injury prevention, as well as performance for the professional, semi-professional, and competitive athletes. I go right there in that last bucket right there. He's also been competitive cycling, golf, and tennis. He himself has played that, and I think it's very important that when people actually participate in the sport, they know what you're talking about when you say to them, hey man, this hurts, or this hurts, or this hurts because I've been playing this, that, or the third. This gentleman is going to give us some insight, some information. Put your hands together for Dr. Bret Hoffman.
Hello. I got to gather some things here for a second. Thank you for the introduction. Yeah, go ahead.
I said Hoffman. It's Hofer, excuse me. Dr. Bret Hofer.
Thank you. Okay, so it's been a while since I've been on stage. And today I want to talk about body maintenance and performance. But before I do that, I want to ask how many of everybody in here, raise a hand. Do you wake up in the morning and you feel stiff? Okay, I would expect that. Okay, thank you, Ken. What is that, zip up my jacket? I know, I'm just kidding. So to prevent that, there are a lot of things you can do. And this is a perfect segue to follow up with Jim. Jim deals with biomechanics. In my profession, biomechanics is also part of what chiropractors do. Work with bodies, joints, muscles, joints, the whole complex, everything from head to toe. And as a chiropractor, I've been fortunate enough to assist and help people over the years in various different sports, as you heard from Rick. I have some good friends who've been professionals. They're in this room that I've had a chance to work with. I have a friend of mine who plays LPGA professional golf. She just won her first tournament this year. I've known her since she was a junior. So a lot of different aspects of athletics that I've also participated in, that I understand how the body moves and how it's supposed to work. So with that being said, there are some things that you can do in the morning before you even get out of your house, right when you wake up out of bed, that can help you with those aches and pains. But there's a lot of other things behind the scenes that are causing that, and following up to Jim, that can be corrected over time, right? And that's why I'm here, talk about some body maintenance and performance. And there's flexibility and there's mobility. They're very different, okay? You could be flexible, but you may not be as mobile, and vice versa, okay? And I'll give you some examples as we go. But first I want to show you a few things that I use regularly, and I mean regularly by daily, to help my body recover, because as we get older and as we forget or neglect our bodies by stretching, massage, hydration, proper bike fit, things to that nature, our bodies start to get used to those patterns, and we create patterns, and those patterns start to restrict our movement. And if we're athletic, what do we need more than anything else? Movement, right? Okay. If we're not athletic, we still need movement, right? We still have to squat to get down on the toilet, right? We have to bend down to tie our shoes, pick things up, pick up children. These are activities of daily living. That's what that's called. So if you see on this side, it's called ADLs. Those are activities of daily living. That's part of mobility. If you can't do those things, the other things you're trying to do in your life are going to suffer, okay? So we're trying to recreate patterns, and that takes training, just like on the bike. You got to ride, to train, to get stronger. Do certain intervals to get certain parts of your physiology to respond to power output, right, and aerobic output. We have to do that with our bodies. If we don't start from the basics, the core, our bodies first, the performance aspect isn't going to follow. Does that make sense? Right? So if I'm trying to take my joints into a certain range of motion and access the muscular power that's in there based on how much muscle capacity you have, if I'm not able to access that full range of motion, then you're going to lose power. Okay? Then you have injuries on top of that, which are the underlying causes of those things too. As Jim said, when there's pain, your body's telling you something's wrong. So that means either your joint complex, ligaments and tendons are locked up because your body's protecting that area. So it's not going to allow the muscles to move and perform and contract and expand to put out force. You're going to have aches and pains. You're going to have imbalances. And then you get a bike fit. And nothing wrong with bike fits. They're great. Right? And not to take anything away from that, but I would say work your body first to get all the kinks out and train your mobility and your flexibility. At the same time, you're getting bike fits, because think of it this way. If you see someone with scoliosis, everyone knows what that is, right? Crooked spine. One half of the body compared to the other half of the body works differently and muscular-wise. So that's an unstable structure, right? Or you could think of a foundation of a house. If you start laying bricks or cinder block at the foundation, and one cinder block or brick is 1 millimeter or 2 millimeters off, and you keep stacking them, the rest of the foundation, the rest of the structure starts to do this, right? So it's unstable. So my point is, getting a bike fit first without finding out what your imbalances are is backwards, if that makes any sense, okay? So, with that being said, if you're having trouble in the mornings, there are some things that you could try. And these are things that I use, that I suggest to people that ask, what do I do about feeling stiff in the morning? Or how can I recover quicker after my exercise, regimen, after cycling, after weightlifting, whatever it may be. A couple of things, everyone knows what this is, right? Okay, does anyone want to use it right now? So this is a Theragun. This is a Theragun. There are many brands out there like this. This is just the one I use. Ones I've sold to patients that ask me what I use, and this is good as anything, right? This was the first one. And it used to be a drill, a regular drill from Home Depot with a piece that was inserted in where you put in a screw or a driver. And it was developed by a chiropractor 15 years ago, I think it was. So it's evolved since then, obviously. Okay, this is good for percussion. You could use this after exercise, cycling. It's good percussion. It will allow your muscles to relax and get blood flow. May get some flexibility out of it too, but this is also a good tool. But I always like to start off in the beginning. I always like to start off with the feet. Right? Our feet are crushed into shoes, cycling shoes, work shoes, sneakers all day long. How many of us walk around barefoot half the day? Nobody, right? If your feet are not balanced, right, the rest of your body, the feet are the foundation, just like the building. If these are off and you're not able to balance your body, the rest of your body is going to falter. So this is a foot massager, basically. You roll your foot on top of this, and it works the structures in between all the joints in your feet. Okay? So you start with that. This is what I do first thing in the morning, after a few neck rolls and some other things, right? The next thing you can do is, these are called chirp wheels. Now, this is similar to a foam roller. I don't know if has anyone ever seen these? Okay, good. So, specific design. It's got a high-density foam on this, hard plastic interior. Now, there's a center channel. Can everyone see that? Okay. Regular foam roller is great. It will help your muscles gain some flexibility along with a stretching routine. But this is designed to go around the spine. So the center channel is where your spine goes. So when you roll back and forth on this, it's deep tissue in the spinal muscles, on both sides of your spine, okay? So, and you'll hear some pops and clicks when you do this. It's called a chirp wheel. I'll provide all this information to everybody. Ken said he's got everyone's email, so I can send out an email at the end of this, and you can have all this information, all right? So there's a few sizes of this. You start off with a larger size just to get used to it. Take some balance, right? This is just a larger version, okay? We also have exercise bands, okay? Everyone's seen these all over the place. You can get these on Amazon. These are great if you don't want to go to the gym and use weights. You can use this for a lot of different things. Good resistance on both ends of the spectrum. So you're going to get resistance extracting it and letting it come back down. So you're going to actually use your muscles in a way that they're designed to, okay? Elasticity and contraction, right? And, well, the other thing's more for injury therapy, but I'll get to that in a minute. But I want to get to the information here, which is important. How many people can touch their toes in the morning? Okay. Why doesn't everybody stand up for me real quick? Okay. Everybody stand up. This is interactive. Too bad. All right. So without bouncing, just go down as far as, don't force yourself. Just naturally let yourself fall forward how far down you can go. Even if you don't touch your toes. But you don't bend your knees either. You don't have to. Don't worry. Okay, come on up. All right, so that is your level of flexibility right now. Okay? You can all sit down. Thank you. That's the first time everybody listened to me. It's been a while. Okay. So why do we need flexibility? Flexibility increases our range of motion. Okay? Why do we need range of motion? So we can be more mobile. Can't have one without the other, right? When we don't have flexibility and we lack range of motion, we're more prone to injury. All right? You see, even the best athletes in the world are prone to that type of injury. So they pull a hamstring if they're sprinting sometimes. There could be a number of reasons why that is. They didn't warm up properly. They didn't hydrate properly. There's a lot of factors, but it can happen. But there's a reason for that. But what does flexibility do? How do we gain flexibility? Well, there's a lot of research that states that the static stretching, where you're sitting or lying or on the floor, and you reach for a leg and you hold it, right? That's a static stretch. If you hold it for more than 10 seconds, right? Stretching a hamstring. That's called a static stretch. There's no movement. You're trying to expand the ligaments and the muscles and the tendons in a short period of time to gain some very limited flexibility, but it doesn't last long. If you want to gain flexibility in that manner, it's going to take you'd have to stretch for 24 hours straight. So your progress is short-lived. So you don't really need to do that type of stretching, okay? As people who exercise, your best bet is what's called dynamic stretching, and I'll get to that, all right? So how does that affect your performance? As I said earlier, when the muscles cannot contract to its fullest potential, because number one, there's no flexibility, which takes the joint itself, right? And this is getting a little bit technical, tell me if I am. But your joints have to be able to move through a full range of motion, right? So if I wanted to go into a squat, and I tried to squat down, and this is as far as I can go, it's my hips and my knees and my ankles that are preventing me from getting to a full squat, right? Where it's called ass to calves or ass to grass, right? So if you're not there, that means you need to look at your joints and how the joints are lacking mobility, okay? So we can get to mobility, right? Anyone have a problem squatting all the way down? Okay. Injury-wise?
So,
Okay.
I do have a super serious question. So I have a fused ankle. I have 3 plates and 18 screws in mine.
All right, there you go.
No way.
Fusion, surgery, right. So you're limited by certain things, and that makes sense. Okay.
Wow.
Right, so there's nothing you can do about that, obviously. Okay. Good point. Thank you for that. So there are limitations, obviously. So how does it affect performance? Muscle contraction, right? Muscle contraction and power. What do we do about that? We work on functional movements, okay? And functional movements are what I mentioned a little bit earlier, are basically activities of daily living. Pushing things, pulling things, squatting, hinging, okay? These are all things we do on a normal basis that we don't even know we're doing. Daily activities, okay? Reaching for something in the cabinet. Turning and grabbing and picking something up. That's rotation. So we have lunging, right? Bending down, grabbing something like this. Rotational movements, things like that. And gait. You can't see it down here. It says gait. Gait is how you walk, all right? All of these things are normal, and we need to work on those to enhance our performance and enhance our range of motion. Okay. Am I confusing anyone? Yeah. All right. So I'm going to bring somebody up here in a minute. We're going to do some of these so you know what it is. And then, like I said, I'll give everything through emails at the end. And if you're interested in that, we can do that. Now, performance. Why do we need to enhance our performance with functional movements? Well, we get more stability in our joints. We get more strength and more balance. And there's 3 planes of movement that the body is supposed to move in, okay? As cyclists, and as most humans, but as cyclists, we're in the sagittal plane. So if you cut yourself in half, left and right, it's called a sagittal plane. We're just moving here, correct? Legs, arms don't move, but just the legs move in this plane, all right? Then there's the transverse plane, which is where rotation comes from. So if there was something that's cutting me through the center, top and bottom, this is transverse plane, so rotation. We don't do any of that as cyclists, right? And then there's the frontal plane, which is side bending, right? So we're fixed in one motion, one plane, a lot of the time, right? We're sitting down, everything's in front of us, right? And we're not doing anything outside of that. So our bodies create those patterns as we're coming back to that. So this is where we have issues with muscle tension, injury, low back pain, knee pain, anything you can think of. As Jim said, if your body is telling you that if you have pain, your body's telling you something's wrong, okay? And it might be able to be fixed by incremental movements in your bike fit, but the best thing you can do is start taking care of your body first, right? Okay. So how do we increase some of those aspects of mobility? We have to have muscle strength, right? The range of motion at the end of your flexibility training that you've gained, muscles have to be strong enough to hold that position, if that makes any sense, okay? So if I took a resistance band from over here and pulled it over here to gain range of motion in my hips and my lumbar spine, my lower back, and I didn't have the strength, my lumbar muscles didn't have the strength to hold it there, it would go back to where it started. So we train strength to add to the flexibility that you gain, okay? With resistance training is another thing that cyclists don't do, right? And I'm only talking basically to cyclists because that's what we all do here, right? If it was a room of different athletes, I would say a lot of different things. But how many people in here use weights? Well, that's more impressive than I thought. Wow, good for you. All right. So you understand the concept. Now, why do you train with weights? Just one person raise their hand. Tell me why. Yeah, go ahead.
Build strength so you turn it into cycling strength.
Okay. All right. You said build strength to turn into cycling strength. Okay. But what about the other 9, 12 hours a day that you're not cycling?
We work.
Okay. All right. So that's my point, right? So it comes back to the front side of this, where the activities of daily living, right? Building strength. Also, you need to access the musculature and the structures that allow you to do the daily activities. Because if you're on your bike all day, then that's your daily activity. Most of us aren't, right? So building stronger bones is important, right? You can prevent injury, you protect your joints from injury, and you increase your mobility and your balance by training with weights, whether it be weights, dumbbells, or resistance bands. Anything that's resistance, okay? As cyclists typically, but not in this room, 75% of the people raise their hand, we don't like weights. We've been told that Weight training for cyclists is no good. You'll get slower. You'll get heavier, and you won't be able to put out the same power. But that's wrong. It all depends on how you train, and it all depends on how you use it after you've trained it. So upper body strength for cyclists is very important because you're statically holding yourself up the entire time you're cycling. The only thing that's moving is from here down, right? Unless you're reaching in your pocket, which needs core strength and balance, right? That's the only time you're moving your upper body. Upper body strength is important. You don't worry about, you don't have to get big or bulky and put on muscle. You just have to be strong. There's a difference, okay? Resistance training will also give you a more forceful contraction of muscle. So if you build muscle, you can contract the muscle more forcefully, which gives you more power. So if you want more power and more strength on the bike, you have to train that muscle to do so. Okay? There's on and off bike things you can do, but it's very important to do weight training off the bike, weight bearing, standing on the ground. Somebody might say, well, but I'm standing on my pedals when I climb. That's different. The pedals are moving, right? That's called an open chain process. Closed chain is when you're on the flat ground, nothing's moving underneath you, and you do a squat or you do a lunge. That's what closed chain is. It builds stronger bones, all right? When your brain knows that you're putting weight down on the top of your structure, it starts to add bone material to all the bones that are being used. So your bones become stronger for that reason, okay? You don't want to go down the road and be an older person and have osteoporosis issues, and that's because there's a lack of resistance training, all right? It's very important, all right? So as I said, does end up increasing power and strength. Now, I'd like to bring somebody up, if someone is willing to show. Okay, come on up. All right. What's your name? Melissa. Everyone say hi to Melissa. Hi, Melissa. All right, I'm going to have to put this down because I need two hands to do this. I'll try to speak up. All right. So we're going to do, first thing is, we'll use the band. This is going to pretty much demonstrate everything we need. To activate certain planes of your resistance, right? You can use this at home, right? Anything you want to do at home to do any of these ADLs back here. Push, pull, squat, lunge, rotation, hinge. All this can be done with a few pieces of equipment, right? A band is a good start, all right? And I'll show you how to do this here. Why don't you stand on that, shoulder width apart. Okay. Good. And then take this. Up into it like this, hold it like this, turn it up. Yep. All right. There you go. Okay. Now, get a little bit wider of the grip. Okay. So she's going to do a squat with a press. So you can come down like this. Okay. Come on and press. Okay.
You so strong.
Feel all right? Okay. So with this movement, So with that movement, she's actually working almost every single muscle in her body. Okay? She's doing push, pull, and hinge, and squat. Okay? But working the entire frontal portion of the body and some of the rear posterior chain, which we need on the bike too. Our back muscles on a bike is very important. Everything behind us, because we're holding ourselves up, right? How many people in here have ridden more than a couple of hours or 3 hours or so, maybe with some hills, they get some lower back tightness, right? I mean, I'm saying here sometimes, right? That could be part of bike fit, but it's also because of weakness, right? When you're bent forward like this, the muscles in the front of your body contract and get shorter, the muscles in the back start to lengthen. So they lose some of the strength because there's nothing causing it for you to hold up because you're on your handlebar. So the pressure's on the front. Make sense? Okay. So we can't forget about the posterior. Right, let me see this. You can step off of that. So now that was, excuse me, that's frontal plane. I'm sorry. Sagittal plane. Okay. Now, for rotation, you can take this same band. I'm going to hold on to one end. So you're going to get a nice firm stance like this. Okay. All right. You're going to grab here like this. There you go. Okay. Keeping these bent. I'm going to hold a little bit of resistance, and you're just going to turn this way. Okay. This is working hips, core, and some back muscles as well. Okay. Keep pulling. All right. This is transverse plane. These are movements we have to do as well on a regular basis, not just if you're cycling. Okay, good. All right. Very good. Okay. Everyone following along so far? Okay, so my point is I want everyone to try to move their bodies into those three different planes. Okay, side bending, that's the next one. All right. So this one is, we are going to have you, let's see if they want to switch. So you're going to get down like this. Okay, get on one knee. Okay. That's all right. Now put this under the far knee over there. Mm-hmm. Good. All right. Hold on to this. And you're going to grab a little bit further down. You're going to come up and rotate like that. Okay? Got it? You can grab a little bit. Okay? Mm-hmm.
Rotate it twice.
Correct. Some rotation of upper body. Okay. Safe. And there's one more thing you could do is if you have some dumbbells at home to work the side bending, right? A lot of people like to work the side abs over here, but to work the whole side of your muscle left and right, the whole side of your body left and right, you would take a dumbbell or a kettlebell or something like that and resist this way. You could stand on this band and do it the same way, right? You could stand here and pull the band, right? Just so you're working this angle as well. These types of exercises are going to help you regularly in everyday life and also help you with any activity that you decide to do. Okay? Any questions for me so far? No? Yeah. Yep.
Can you display correct squat?
Correct squat. Okay. Well, that's kind of a loaded question because everyone has a different version of their squat based on what their body can do, okay? But if you're asking me as far as what you're trying to achieve for angles, is that ideally the question?
Well, he was mentioning how, people may be doing it wrong, not being able to go as low as they can.
Right.
So how, what would be a good example of how low you should be going?
Okay. Going as low as you can is going as low as you should. Does that if that's fair to say to you? Only because you and I might have a different version of a squat based on our body mechanics, okay? So if you have an injury or something that's limiting your mobility to do a squat on what you've seen on YouTube or TV, you're going to struggle to get to that point, and you're going to cause related injuries. So it's hard to answer that. I'd like to, but you could train to get there. I wasn't able to do a deep squat until a few years ago. Pandemic hit. I put a gym in my garage. I didn't have a leg press machine because the gym was closed, so I started squatting. But I wasn't able to go down as far as I am now. I just progressively worked at it, right? I allowed my knees to get a little more flexibility and range of motion, my hips, my ankles, so it all progressed. So you can get to that point, you just have to work at it, okay? But proper form, ideally proper form is from the side. You see a lot of people do this, and then they squat down. That's not good for the lower back, okay? You're ideally, in a perfect world, you want to bring your hips straight down behind your ankles or behind your heels. So if you have something on your back, the squat rack, and you're trying to squat down, or even a dumbbell in your hand, you're just going to come straight down like this. Okay? And your knees go over your toes. Okay? If you can, right? Some people don't have that type of mobility, so they do more of a hip hinge squat, right? If you're trying to access more depth, put a small wedge or a small thin plate underneath your heels, and that'll allow your knees to go more forward and gain more ankle mobility. So ankles and knees are really what's key in a squat. Rasan, you had a question?
No, I was just gonna say, so I used to lift a lot when
Yeah.
I was racing full time, and one of the things I was taught, to his question, they literally taught us to squat off of our seat height. There was no reason to go deeper than your seat height because you're not using those muscles. I don't know how much sense that made, but that's what I was taught, and that's how I always squatted. So even today, I'm in the gym a little bit. I squat my seat height basically. You know, so as much as my knee bend, that's how much I go down.
That's right, and there's nothing wrong with that either. There's really no rule to that because you're still squatting in that position, and you're using the muscles you need to use. The point is how much more mobility can you get? Is the more mobility you have in those joints, the more range of motion you have, which means you can build more strength and get more power. Right? Even though you're not changing your position on your bike, which I understand what you're saying. If that's all you're doing, that makes sense. You don't need to go any further than that. But as we get older, your joints only get used to that position that you've been putting it in. So if you're concerned about being more mobile as you get older, and when you stop that activity, you're going to need that mobility. Okay, good. Yes. In the back? Yeah.
So after a long ride, maybe I'm not tanked out, but my shoulders and my neck begin to tighten up. I could go 50 more miles, but my neck and my shoulders are so tight. That's when I start to slow down.
I see.
How do I address that?
Okay. Well, that would also be something for Jim to address because your bike position could be causing that.
So
Right.
say I just got fit. All that is good. Are there any exercises?
Yes.
And I know when I'm riding, I need to relax my shoulders. They should be back. But even with that, I still have the tightness. I still have the pain after a while.
Okay. There are exercises you can do. Shoulder presses. Take some weights, press them above your head. Okay. Make sure you don't arch your back this way. You want to keep a nice tight core and do shoulder presses. You could do it with, as you saw her do, Melissa, right? As you saw Melissa do with the squat press on the band, you could do that with just standing here and doing that. Or if you have dumbbells, do it that way. Shoulder shrugs, which are good for the trapezius muscle, which are the muscles that hold your neck up. You take a few dumbbells or even a band like this and stand on it and do your shoulder to your ear. It's called a shrug. So if you're shrugging your shoulders.
So build those muscles.
Correct. Build those muscles. And then there's one more that you could also do. Let me put this down. Good warm-ups too, especially if you're riding or whatever sport. Prep your body before you ride. So dynamic movements. These are all good to do beforehand. First, let me go back real quick before I answer the rest of this. Static stretching is where you stretch down and hold it. Do not do that before you ride. Do not do that before you race. Don't do a static stretch before any activity. That actually causes the muscle fibers to separate, go further away, and they lose their tension. So the contraction rate is going to be slower. So you will lose speed, lose power if you static stretch before you compete or ride. Should be dynamic movements. Okay? Things that are in motion, whether that be like these things, lunges, hinges. Those are all active stretches, believe it or not. Okay? So don't stretch on the floor before a race, before a ride, and hold it for more than 3 seconds. Okay? Anything longer than 3 seconds, you're going to cause yourself a little bit, it's going to cause your muscles to react slowly. Okay? You see it all the time. People doing that all the time. And I get it. That's what we see. That's what we've been taught. We've been told. Okay? Try not to do that. Do the opposite. Do a 2 or 3 second stretch. You can even do slight bounces, controlled bounces like this. and I'll answer the rest of your question real quick. So there's a series that I do before I get out and ride, just to loosen up the hamstrings. And you can do it in place. You can walk across your floor and do it. Heel to the floor, like this. Heel to the floor, hinge. How to wipe your hand. You do that, and you walk back and forth 10, 15 times. You loosen up your hamstrings. Do that again. Heel out, hinge, and then bend forward, your stomach or chest towards your knee. Right? Same thing. Step back and do it just like this. And you're only doing it for a second. You walk back and forth. And you're in place. Okay. That's a good warm up for your upper body or your lower body. Where'd I put my thing? All right. So to exercise and work on some of those back muscles, you would take a band like this. How much time do I have? Wrap it up. Okay. Wrap it up. Okay. You hold it out here, and you just pull across. All right? Pull it apart. Elbows locked out, pull it apart. Okay? You'll feel it in the back of between your shoulder blades. All right? And there's another one that's called a face pull. If this was attached to something stable here, I would take two ends like this, and I'll pull it this way towards my face. It's called a face pull. So you're basically, think about a pencil between your shoulder blades, trying to squeeze that between the shoulder blades. All right? These are muscles we don't use when we're riding. So they get weak, as I said earlier. So these are little things you can do to strengthen them. Okay? All right. Anyone else? Yes.
When I'm not on a bike, I'm in front of a computer.
Okay.
What tips do you have for maybe improving posture?
Everything I just said.
Okay, perfect. I appreciate that question. I'll finish up. I used to do ergonomics and ergonomic desk classes for years ago, Walmart and Home Depot. I would show up and set up their folks in the office administrative with the ergonomics at their desk, give them desk exercises. Now you can go on Google and just Google desk exercises. There's plenty of them to do right at your desk. Best thing is, take a 5-minute break every 20 minutes if you can, and do a few of those. Just find those on Google. It's so easy. But these are all good tools you can use to do this as well. Okay? Thank you.
Yeah, you're welcome. Yes?
Also, will come by the desk where you can stand up and work.
Right.
Really, really helps.
Correct. That's right. Standing desk. Good point. Thank you for that. Okay. I think I finished everything I needed to say. Thank you, guys.
You know what? Give another round of applause for Dr. Bret Hofer. Bret, I want to tell you this. You said something about, the dynamic stretching. For the longest time, I've been stretching the wrong way. I was back there like a light bulb just went over my head. Like, damn, I wish I would have met Bret so many years ago, man. Well, actually 2 years ago, 3 years ago. But great information. Thank you very much, my friend. And you know what? Something that I meant to ask Jim a little bit earlier. Are you on social media, Bret?
Yes.
Is it possible for people to go ahead and follow you? Because I'm pretty sure some of the stuff that you said just now, they want to get some more of that information.
Sure can. How can they follow me? Okay. So my handle would be. You gotta look up your hands. Yeah. No, it's the Fit. No, it's the Fit BH. My initials Bret Hofer. _ DC for Dr. Chiropractic. So the Fit BH _ DC. If you want to follow me, that's fine. But I asked Ken. Ken will give me access. I'll give him the information that he can email everybody. Anything you want to know about what I spoke about today, and hopefully to help you out. Okay? Thanks, Greg.
No problem. Thanks again, Bret. This information that you're getting, it helps out a whole lot, right? Do you feel like you've learned something just with Dr. Bret along with Jim? You feel like you're learning a lot more, right?